My name is Madison Gray. I'm a student nurse at the University of South Alabama, and today I'm going to be doing the central line dressing change checkoff. So she's going to scan the room. So first I'm going to verify the order and hospital policy and perform hand hygiene. And then I'm going to identify my patient using two identifiers. So I have Jaguar Jones, date of birth 8/25/1963, 8/25/1963. I'm going to assess his allergies. He has an allergy to penicillin. And then I would explain the procedure to my patient and provide privacy. So the first thing I would also make sure I gather all of my equipment too. And then I'm going to assess and palpate the area. So I'm going to be looking for any signs of inflammation, odor, drainage that would indicate an infection. And if I did see that, then I would obtain a wound culture. So then I'm going to position my table at my waist level, close to the insertion site with all of my equipment. I'm going to position my trash can where I need it and perform hand hygiene. I would raise the bed to a comfortable working height, lower the side rails, and make sure the head of the bed was elevated slightly. So now I'm going to open my kit. Put that away. And I'm just going to open the first flap, and I'm going to put my mask on first. And then I would put the patient's mask on and put my goggles on and then put my gloves on. And for the sake of this video, I'm going to keep my mask pulled down too. Okay, so now that I have my clean gloves on, I'm going to begin removing the tegaderm. So I'm going to be removing it towards the insertion site. Making sure to stabilize the catheter while I do it. And then I'm going to be looking at the insertion site and the surrounding skin, and if there are any signs and symptoms of complications. And then if a wound culture was indicated, I would do that now. I'm going to remove the bio patch as well. And I'm going to dispose of that into my glove. Dispose of that, and I perform hand hygiene, and now I'm going to open the rest of my kit. Using sterile technique, and then I'm going to put my sterile gloves on. I'm going to adjust all my fingers. And then I'm going to organize all of my supplies on my sterile field. And then I'm going to begin cleaning with the alcohol prep. I'm going to dispose of that above my waist. And so I'm going to clean this in circular motions, inward to outward, according to the hospital policy, making sure not to cross the same spot as I clean. Okay, then I'm going to dispose of that, and I'm going to clean with the ChloraPrep. I would activate it with the butterfly wings, and I'm going to stabilize the catheter with my non-dominant hand so it is now contaminated, and I'm going to clean vigorously for at least 30 seconds in vertical to horizontal motions. Would clean underneath and as well clean on the catheter site, making sure it's all clean. And then I would dispose of that, and then I'm going to apply, I would make sure to let it dry first, and then I'm going to apply the bio patch. I'm going to apply it with the blue side facing upwards. And then I'm going to apply the Tegaderm. So So I'm gonna be careful, I'm only gonna touch the paper with my hand so I do not contaminate the sterile portion. And then I'm going to apply it. Making sure it is on good. And then I'm gonna remove the paper, and as I'm removing the paper, I'm gonna be making sure that the Tegaderm is secured onto the patient's skin. And then I'm going to keep this for my label. And I'm going to remove my gloves. My goggles, and then I'd remove my mask as well as the patient's mask, and then I am going to put the label. I'm gonna make my label. So what I'm gonna put on my label is the date, time, and my initials, and then I'm gonna apply it to the Tegaderm. So I'm gonna apply it not on the insertion site, so it does not cover up the insertion site. I'm gonna dispose of this. And then I would raise the side rails, lower the bed back to the lowest position, make sure the patient's comfortable and the call light is in reach. I will dispose of all of my equipment, and then I'll perform hand hygiene and I'll document. So what I'm gonna document for is the appearance of the site, the drainage, the amount, the characteristics, if there was a culture obtained, the type of cleanser that was used, the type of dressing, and the patient's tolerance, and then the date, time, and the signature. Thank you.